Hello. Hi,
Hello.
Rachel. Thanks so much for joining me today. And thanks to everybody else who's going to watch and perhaps listen along. Rachel is a wonderful speech and language therapist who specialises in working with adults with DLD. And so we're going to do an interview today to talk about what DLD is, kind of what people should really know, what you can do if you are working with or know someone with DLD. So the first question, before I say that term anymore without people knowing what it's all about, Rachel, welcome. And could you start by telling us what DLD is?
Absolutely. And thanks very much, Jess. I'm delighted to be with you today. So DLD, or Developmental Language Disorder, is a lifelong neurodevelopmental condition. And it affects people's ability to understand and use spoken and written language. It's much less known about than other kinds of neurodivergence, although it is in fact relatively common. And some people think of it as a hidden disability, and other people sometimes refer to it as a specific learning difference. And in fact, there have been lots of terms used about it in the past, which is quite confusing. There are terms like specific language impairment, or SLI, receptive or expressive language delay or disorder, and developmental dysphasia. And in 2017, there was a project to bring all those terms together under this one umbrella of the term Developmental Language Disorder, or DLD.
Wow. And that's pretty recent, isn't it, when you think about it? And that's not dissimilar to a lot of the other changes I think that we're seeing with some of the other neurodevelopmental differences. And you may be aware, but I was actually quite shocked recently to find out that when you look at ADHD and autism, until 2013, I believe it was, you couldn't get diagnosed with both of those things at the same time. So people didn't believe in the medical profession. Maybe some individuals did, but as a whole, that you could be both. So it really does show how much things are changing, and I think will continue to change. But you talked about it being really common. So how common is DLD, or what's our best guess on what that looks like?
So there's been research done to show that in young children in school at school entry, there are approximately 7% of those children had enough features of language and communication difficulties to have a diagnosis of DLD. And as it is there's not been an awful lot of research. It's quite recent that research has been done into DLD in adults. So there are no separate statistics, but as it is a lifelong condition, we have to assume that there are 7% of adults out there that have DLD. There's a lot of problems with showing the evidence of that because DLD is severely underdiagnosed, and many of the people that have it and don't have a diagnosis for it are overrepresented in services like prison, inpatient mental health services, homelessness, and so or they're just out there working and living but just not aware that they have DLD.
Wow. Yeah, I mean, it's such a huge part of how we operate in society, language, right, isn't it? So of course it's going to have a big impact on people. So if you don't know it about yourself, much like a lot of the other neurodevelopmental differences, but a lot of them are talked about so much more. So I think it's, I feel very, very passionately about this topic as well, and getting more people to recognize it, not just for the prevalence, because I personally think it's really important for us to understand the numbers, or our best guesses at the numbers around a lot of the different neurodevelopmental differences. However, I don't like some of these conversations that some people have around it's more common than this one and it's more common than that one, and therefore we need to talk about it more. Mm-hmm. What we talk about all of them, and it's why I really think when we're talking about potentially there's a current campaign, I think, to screen for, well, it started off as autism and ADHD, and it's got broader in primary school children. And who knows if that will go through or not. But if it does, it needs to be for all of these differences. And especially with how languages, you can go ask about your perspective on this in a second, in terms of how it plays out for people, both children and adults, obviously. But that can almost present as another neurological difference if you don't understand it well. Or it can kind of cover up certain parts of other neurodevelopmental differences too. So it's such a complex topic.
Absolutely, yeah.
So can you talk a little bit more about the language difficulties that people with DLD face? Like, what does that really look like for them?
Yes. So in children, it sometimes can be a bit more obvious. So children may have real difficulties with understanding a lot of things that are said to them, and learning and being able to participate in the classroom and make friendships, interact in friendships. And a lot of those things do carry through into adults, but adults do, the sort of things that adults find difficult are remembering and understanding things that people say to them. So questions, instructions, stories. People quite often find it quite difficult to follow stories that you tell them, or perhaps they read, or even if they see it in a film. People often, they might have quite good vocabularies, but they have these sort of gaps in their vocabulary, often because of the learning where that's from school, where they've been unable, not really understood what they're being taught, and therefore there are these gaps. They also have difficulties remembering the words they know, so they might have quite an extensive understanding of words, but they may find it very difficult to find the word that they want when they want to use it. They may find it difficult to say long words, to get the sequence of the sounds within long words. They find it very difficult to express their thoughts, so to get their opinions out, or explanations or descriptions of things. So it may be all very clear to them in their head, but actually to translate that into the spoken word and indeed the written word often is very, very difficult. And sort of complicated language tasks like negotiating or arguing, which are very dependent on sort of coming up with things at speed, are very difficult. So that processing of language, the taking it in at speed, and the formulating what you want to say at speed and under pressure is particularly there's going to be a huge difference between what people are able to produce when they're under pressure, and particularly time pressure, and when they're not. It's almost like that's bigger than you would expect in a neurotypical person. They find it's very difficult to talk on the phone very often, because of they're actually quite dependent. They often don't realize it, but they're quite dependent on a degree of lip reading quite often to support their understanding, and very dependent on non-verbal communication, which obviously you don't get when you're on the phone, as well as that sort of time pressure when you're on the phone, where you sort of pauses are even less acceptable than they are in just a face-to-face conversation with someone. They find it really difficult in group situations to participate in discussion. Just the whole thing of having to take in what one person says and another person says over here, and then get your own ideas out and get those in sync with the discussion is really hard, and people find those sort of situations often very stressful. And making conversation, just coming up with conversation and keeping it going, is very difficult. That sort of pressure to come up with and think of what questions to ask, or how to respond. And so all those things have a big impact on people's employment, their education, their relationships, and their mental and physical health.
Wow, I was scribbling so many notes there, because it's so complex, isn't it? And just to kind of touch on a few things that you made me think about at the beginning of that, you were talking about sometimes the difficulty in following instructions, and that, I imagine, is so often misinterpreted as someone perhaps who won't follow instructions, or perhaps someone who has ADHD, for example. Some of the things you were talking about remembering, I was thinking, I bet people look at some people with DLD and make assumptions that it's their working memory in relation to having ADHD, when that could not actually be the case. And I find it so fast. I won't go off on too much of a rant, but the recent video from the Department of Education where Bridget Phillips was talking about children not being school ready, you may have seen it, and that they can't follow instructions and they can't sit still. And I've got so much to say on it, but I won't go off on too much of a tangent. But the follow instructions thing is so important because we are not getting to the root cause of why children can't follow instructions at such an early age. And there's so many reasons. Not all of those children will have DLD, obviously, but some of them will. And so we don't actually start to look at that for children. And if we do, we often then misinterpret it because so many people working in education have never even heard of DLD, let alone know what to look for and how to understand that. I know your work is with adults, but I imagine a lot of the adults you worked with are struggling as a result of not being understood, nothing being explained to them in terms of why they're perhaps experiencing what they're experiencing and being given the right support and interventions.
Absolutely. And, a lot of people found their school experiences either a complete waste of time or very traumatic for those very reasons. That continual need to keep up with instructions and answer questions and having to rely on friends to make sense of what was going on. And then, of course, gaps in your education as a result of that. But, instructions are, of course, equally important when you're an adult and, perhaps when you're that sort of situation where you're at work and, you pass a colleague or your boss in the corridor and they give you a quick instruction about something and, there's zero chance of you remembering it and or taking in what they meant. You can't even see their face when they're doing it. Or a simple situation like perhaps being in a chemist and the pharmacist giving you some instructions for how to take your medication verbally and not being able to take that in, so all sorts of sort of situations where you have instructions. And then of course questions, questions can be a problem in any situation, but in an extreme sense, perhaps, in things like interviews, where that thing of being put on the spot when you have DLD has a tendency to just make your mind go completely blank. And so therefore, then you can't even show what you know and understand. But like you say, that could be massively misinterpreted as you just not knowing what you're talking about. Or like you said, if you don't follow instructions, that you're lazy or you didn't do, you're not doing your job. Or if you don't respond to a question, you're just antisocial, or you don't come out to the pub for a drink after work, but you're antisocial, whereas it may just be that you cannot deal with those sort of group situations because you can't keep up with the speed of conversation.
They are all such good examples because so many of these things we talk about in relation to neurodivergence quite a lot, but all of the examples I get kind of here being talked about are around autism and ADHD and perhaps dyslexia. So your example about the pub, people do talk about it and how it's very difficult for neurodivergent people. What they're really talking about is autistic people. They're actually not saying, oh, there's another group of people too can have, well, no, I'll come on to whether you can have both in a second because that's contentious, isn't it? But this is equally as important. And one of the things that you mentioned, which I think is really interesting, is around, well, you were talking about all of the different ways that you can experience having DLD. And in my experience, I don't have DLD, but knowing people with DLD, and correct me if I'm wrong, for some of them, the vocabulary perhaps is not necessarily, like you said, you might have gaps, but you could probably get away with people not really noticing. It might be that actually you speak perfectly well and people wouldn't think that there was an issue with language, but you're actually struggling in other areas. So maybe to retain that or to understand what people are saying. So is it that some people, to someone who doesn't know very much about DLD, or even sometimes someone who might know a lot about DLD, you would never notice that someone perhaps had it. And they're kind of, they're struggling with other parts of it, but they sound and they speak to you in a very typical way. Is that the case for some people?
For some people, yeah, I think you would notice it in quite a lot of people. You might notice, for instance, that they are very different in different situations. But but that their language is very different in different situations. You know, sometimes it's evident. It's obviously always depends on what you're looking for, or if you know what you're looking for. But, you know, people can be quite hesitant. They may be long pauses as they're trying to formulate what they want to say. They may lose track in the middle of what they're trying to say. They may keep restarting. Or they may just sort of look at you blankly, or, you know, when you say something to them, or have a long pause before they respond. Those sort of things might give you some ideas. Or they might say the wrong word for something and may or may not notice. And that's where a different word has come out from the word that they actually intended to say. People sometimes have difficulty with sort of figurative language, so non-literal sort of language and sayings, and they might kind of get their sayings a bit wrong, or the order of their words might be a bit wrong. It might be like the grammar might be not quite what you're expecting. So there are signs there, but they might be quite subtle by the time they get to adulthood. And generally speaking, when we communicate, we're not very focused on those sort of things. We're listening to what people are saying, the content of it. But it may be that when you're talking to someone, if you always sort of really kind of slightly struggling to understand what it is that they're saying, or it seems like it's quite hard to get the point of what they're saying, you know, that might be a sign that they're really struggling to get it out. But on the other side of what you're saying, people find it quite frustrating when people say to them, "Oh, you talk fine." Because people have quite a limited idea of what that actually means. They're perhaps expecting a speech disorder, that the sounds of your speech might be different. Or it's just that in a very limited sort of conversation about perhaps something practical, it might not be obvious. Perhaps that person's very reliant on scripts. They've scripted that conversation, or it's one that they've said very often, and therefore that can come out relatively smoothly. But it also might be that they appear, you know, that people with DLD are champion maskers, and may appear that they communicate, you know, that their language is, you know, they're communicating very effectively, but underneath there's a high level of anxiety and panic and activity as they're desperately trying to keep up with understanding and formulating what they want to say.
Yeah, that more brilliant examples to bring it to life. And I love that you've talked about masking in this context, because again, it's something that a lot of people, that term has become very familiar when talking about autism, but actually there is lots of different applications of it, and this one is a really, really good example. And I imagine that in the workplace, for a lot of people who can mask are doing that an awful lot of the time. And the scripting thing, again, something that you would typically think about when you're thinking about someone who's autistic, but in this case, again, you would use it for different purposes, but in the same way. And I imagine people kind of learn phrases, and this is the kind of thing I can say in response to that, and maybe this is the kind of thing I can say, and I can practice it.
Yes, and there may be that sort of social sort of side where people are not quite sure about certain sort of situations, but that scripting is largely, as you say, it's for a slightly different reason. Often it's because that on that sort of live kind of formulation of what you want to say is so difficult that if you can prepare it beforehand in some sort of form, then that, you know, and prepare it, make some notes, rehearse it, then that can be incredibly helpful.
Yeah. So I find this topic so fascinating. And one of the other things that you mentioned before was around sometimes a reliance on maybe body language or facial expressions, lip reading, all of these kind of things. And I love that in the context of when people are talking about video calls, which are such a big part of many people's work now. And there's huge debate around this cameras on, cameras off thing. And I absolutely firmly sit in the camp of there are good ways of doing it for different types of people, and we shouldn't have a blanket policy at all that we should always have our cameras on. However, I do always use the example that for some deaf people, lip reading is really important. So actually, if you are speaking, then you probably could benefit from turning your camera on. And this is another great example of other people that will benefit from that as well, that people typically wouldn't have thought about.
Yes, and I think that unfortunately people with DLD have suffered a little bit from this increased awareness that some people find it challenging to be shown and find it easier to have their video off, because actually they lose out in that sort of situation. And actually even a video call itself is, you lose something. People with DLD often say that they'd rather have a video call than a phone call, but even a video call, you just don't get that same sense of you don't get all those sort of signs, that subtlety of body language that people would get face to face, and you don't get that sense of connection with people in quite the same way. And there are also those tiny time delays in video calls, which, given that you've got a system that finds it difficult to keep up timing wise in terms of language anyway, any sort of slight sort of delay there, I think on some level does present a challenge.
Oh, wow. I mean, this is why I talk so much about, when we talk about neuroinclusion, so specifically when I'm working in workplaces, I think people are looking for like a list of adjustments or a list of the ways that we should do things. And actually what I talk about is that you need to implement choice and flexibility and people being able to advocate for themselves, because you can't have one way of working that's going to work for every single person. But what you can do is allow people to tell you and then flex the approach depending on perhaps who you've got in your team and what they need at particular times. It's never possible to do it for everybody. It's not, because this highlights the complexity of it. You will have some people who will benefit from cameras on or being in person to get that connection because of their own disability. But there will be other people who then find that difficult because of their disability. That's the reality of what we're facing. But the more that we can talk about our needs, the more often, hopefully than not, we can start to work with people in the best way for them.
Absolutely. Yeah, completely agree.
I have so many questions for you, but to move on to one of the other kind of areas that we were going to talk about today, kind of around assessments, supports, therapies, what all of that can look like. You know, if there's anybody that's relating to this or people know of anybody, it would be really useful to understand maybe why, particularly adults, or if you've got any thoughts on children, to share them too, but why they would come to a speech and language therapist like you for an assessment. What brings people to you?
Yeah, well, there are sort of a range of reasons, and I do get people coming to me for an assessment. I do get people that have been diagnosed as children, but actually they're the minority. There are some people that are diagnosed as young adults. You know, there is a slight improvement in the diagnosis rate for children. So as those people come through to young adulthood, hopefully there are a few more of them that have been diagnosed. But the sort of reason after that, I get people coming through from their 20s through to their 60s, you know, so there's a wide range of times that can happen. And that's particularly because there is a not very good awareness of DLD, public awareness of DLD. So they may just never have heard of it, you know, and some people come to me and say I've been searching for many years for some sort of explanation for what's going on. So that's one big reason. People want to understand why they are struggling so much, or why they've always struggled so much. Perhaps why they haven't achieved their potential. You know, maybe they're not in work, or they're not in the kind of work that they are intelligent and capable enough to do or want to do. Often they are really struggling. So they might have a job and they might have a family or be in a relationship, but they may be really struggling in terms of their mental health and well-being, and sometimes the knock-on effect on their physical health, because they've had all these years of not really understanding what's going on with them. You know, similar to other neurodevelopmental conditions, many years of masking, maybe thinking they're stupid, or knowing they're not stupid, but not really understanding why they find things so difficult. They may be quite socially isolated as a result of just finding the whole conversation, interaction, group situations so difficult. They may be very frustrated because they just can't say the things that they're thinking. And all these things do have a big impact, as I said, on mental health. So sometimes I think people come when they're at a crisis point, or they're at a point where they just find out about DLD in some way. It's very inconsistent the way people find that out. And they think, oh, wow, that sounds a bit like me, you know. But then, of course, they've got to find a speech and language therapist who can help them and assess them for that. So that in itself, which I can talk about a bit later, it presents huge problems. So that's sort of a bit of a snapshot of why people come to see me.
Yeah, well, loads of different reasons, as you just said there, and I expect for many a combination of all of the above. And you mentioned let's go into it because I think it is really important. As you know, I've had personal experience in trying to find speech and language therapists, and I've had I've spoken to a lot of speech and language therapists who have said that that there is it's very problematic what's happening, that people want to know more, that the awareness is increasing, which is great, but the demand, unfortunately, now is like with many other neurodevelopmental differences, higher than perhaps people can cater for right now. But what do you find that people are we're reaching a point where more people are trying to seek an assessment and it's hard for them to do that?
Yeah, absolutely. So at the moment there are no specific services, NHS services for assessment of adult DLD.
Wow.
So none at all, and there never have been. So across the country there are some speech and language therapy services or neurodevelopmental teams where they may do that kind of assessment. So generally speaking, as you probably know, the NHS neurodevelopmental teams tend to be set up for assessment of autism, sometimes ADHD, and occasionally other things. But DLD is never advertised as one of them. I've yet to find an NHS team that says they assess for that. So basically, in order to get into that team and to get an assessment, you kind of need to know somebody who knows that that's possible. And often that is a speech and language therapist. So you might know a speech and language therapist, or perhaps your child's got either DLD or another neurodevelopmental condition. But it is very much the luck of the draw. Often your GP might not know about it. So there's two possibilities. There might be a neurodevelopmental team where if you haven't got autism, or they think that if you're not autistic or they think you might be autistic and there might be something else, then you might get a speech and language therapy assessment and possibly a diagnosis of DLD or a language disorder might come out of that. Or possibly you might have an adult neurology team, which is more for people that have acquired language difficulties, where they've acquired it as part of a stroke or a progressive disease or a head injury. And again, there may be a little bit of flexibility within that team to assess for DLD. But often teams will say they don't assess for any kind of developmental conditions at all within that kind of team. So it's very inconsistent across the country. And some places you can't get assessed for it at all. And, obviously, even if you can, there's going to be a wait. If you're going for one of those teams where they assess for autism and ADHD, you're going to be in the same kind of massive waitings list that everybody else is for those things. So that is a big problem. And there are independent speech and language therapists. That's what I do, who will assess for DLD, but there aren't many of us. And so unless you're in a specific setting, like you work within youth justice, or you work in a mental health, inpatient mental health area, or perhaps in homelessness, then you might find a few therapists doing assessments within that setting. But in the wider public, there aren't very many. So there is the Association of Speech and Language Therapists in Independent Practice, which I'm a member of, and you can look there for an independent speech and language therapist. But so speech and language therapy assessment services are very limited.
Wow. And it just whilst you were speaking, I was thinking that, because I know you're doing an awful lot of work to try and raise awareness of DLD and get more people to understand it. And I imagine there are groups of people that you believe would be very important to reach as part of this. So some of the ones that you mentioned, perhaps, like, I don't know how much training, if any, or awareness goes into other people working in these neurodevelopmental clinics that assess for autism and ADHD. Is that a group? Where do you see, obviously it would be ideal if it was everywhere. I think teachers should understand about it, every workplace should understand about it, but where do you see the kind of key groups of people that we really need to start raising awareness of DLD to change this impact, especially for adults?
Well, I suppose there's lots of places, really. Yeah, I think, the workplace is a huge thing, because I think that, people difficulties do get picked up there, but most workplaces haven't heard of DLD and they wouldn't know where to refer anyone to. And this is the problem, that these two things, like, wouldn't recognize it. And then even if I did recognize it, where would I refer them to? Because there aren't those care pathways set up. And as I say, GPs often don't even know about the services that they might access in their areas, even, such as they are. So I think, employers are a huge thing. GPs are massive. I wish that there could be more education of GPs about DLD altogether, but particularly in adulthood. I think student services within universities, often very little awareness of DLD there. And, that bit where you see about the DSA and the disability support team in a university, where they say what kind of conditions they offer support for. Again, yet to see DLD on one of those lists, which, doesn't necessarily mean they've never heard of it, but it doesn't kind of, give you a strong sense that they are going to know what a person's needs are there. So so many different kind of services, obviously, like employment services in terms of getting into work, I think is a huge thing as well. And mental health services are huge, I think, as well, because there's lots of kind of mental health support that people with DLD often need, but there are also a lot of kinds of mental health support that are very difficult for them to access because of their language communication difficulties.
I mean, that is such a good point, and one I know really, really well. Because when we talk about often therapy and therapeutic intervention for people with mental health difficulties, so much of it is talking therapy. And even if it's not talking therapy, there is a really significant part of language that's associated with that. So even, I found working with parents of children who have language disorders and language difficulties, they don't even know what's available to them to know what to ask for. And these mental health services don't know either, so they're totally stuck. So that is a huge problem in itself. And I think, listening to these, groups of people, it really is everybody, isn't it? There's so many different areas. And I think this, to me, is one of the things that is so important to highlight, because it shows that no matter how far we've come in the neurodiversity movement, which is far, we are making progress. It's slow, but we're making progress. But we cannot leave some of these differences behind, because it's not good enough, I don't think, for us to be, these are the areas of support we offer for differences like autism, ADHD, dyslexia, but no DLD, or no, this isn't the only one, right? There's other differences that don't get the same kind of airtime or prominence. So I think, if anyone is watching, please go and do some more listening and learning and reading and researching, because it's so important.
And I just wanted to say there that it is very frustrating for adults with DLD, and for someone who works with adults with DLD, to see, legislation or services which would be so useful for people with DLD, but are just not commissioned for them. So I've often tried to help people get access to sort of employment support services or supported employment services, and they're just not commissioned for people. It's very disheartening to hear, well, no, we're only commissioned to work with autistic people or people with a learning disability, and DLD never gets a look in there, even though it would be equally useful. And legislation, like things like the Buckland Review of Autism Employment, and I'm, reading that and thinking how much of that would be useful for people with DLD, and why can't they just be included as another group of people that, could really benefit from that. And I think people with DLD feel invisible a lot of the time.
Yeah, I totally hear that. And I imagine things like access to work, and people working within access to work don't really know what DLD is, let alone
No.
the actual process of getting access to work is clearly not set up for somebody with DLD. It would be impossible for them to work through the language in terms of the forms and the things that you need to submit and then go through in terms of an interview and things like that. So and again, whenever people, sorry, go on, Rachel.
Yeah, no, I mean, access to work is one of the less bad ones. And in fact, I have done some training with access to work assessors.
Right.
But it's just like, I think, well, often when people get to the interview, like the workplace assessment, that people with DLD are not quite sure what to ask for, you know, or what's available, what the possibilities are. So sometimes they might end up with a package which isn't really quite what they need. So, for instance, you know, they can ask for a speech and language therapist as a workplace coach, but, you know, they wouldn't necessarily know that. And, you know, access to work assessors might not know that either. They might end up with someone that doesn't really quite meet their needs. So, yeah, that certainly is the case.
That's such a good point, because I see that in our work in workplaces all the time, more broadly, that you have like a neurodivergent person who perhaps is being listened to by their manager, but neither the manager or the neurodivergent person knows what to do, what adjustments they need, what's possible. And so it's not often for the want of trying, which is why we need to try to figure out how we bring the expertise in to say what could be useful.